Hello, and thank you for joining us for the Environmental Public Health Information Session. My name is Erin Ruggieri, and I am one of the marketing coordinators in the School of Health Sciences at BCIT. So I've been doing info sessions all week for lots of different health science programs, and tonight we're going to focus on environmental public health. Our main presenter is going to be Dale Chen. He's the program head for environmental public health. I would like to share that the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of the Squamish, Tsleil-Waututh, and Musqueam. And I know since we're on Zoom tonight, we're all coming from various areas. We could be at home, work, school, out somewhere. So I know that I am currently actually on the unceded traditional territory of the Quake-Quitlam Nation. And if you'd like to take a moment to think to yourself which territory you're on as well, that would be wonderful. Thank you. So our agenda this evening, we're starting with our welcome and introductions. In a moment, I'm going to do a little poll to see how much you guys know about environmental public health. I'm going to watch a video about the program. And then Dale's going to continue with the presentation and program overview, some information about program advising, admissions, applications. And then, as I mentioned, we'll have a Q&A towards the end. So at this point, I'm going to bring up the poll. So what is not a part of an environmental health officer's job description? What thing do they not do? Do they not inspect restaurants, inspect drinking water systems, inspect fish and wildlife habitat, inspect tattoo parlors, investigate communicable disease outbreaks? So choose the one that you think they do not do. Okay, I'm going to end it there, share the results. Dale, what do you think?
Most people got it correct. It's inspect fish and wildlife habitats. So no, great. Good job, everyone.
Okay. And I'm going to switch over to my other screen. I'm going to share a video right now on environmental public health.
Hey, I'm Zach. I'm from Fraser Health.
Pleased to meet you. Want to show you around?
Perfect. So today, I'm doing an inspection here at this food processor. We'll be looking at making sure that sanitizers are available, that the staff are following proper hygiene practices, making sure that coolers and other cooking equipment is functioning properly. So there's a wide range of things that we are working towards to make sure that food safety and sanitation are being followed closely. So I love my job because every day is a new day. I enjoy seeing the collaboration with our health unit and seeing their successes, because when our operators are successful, we're successful.
Our environmental health program here at BCIT trains students to become environmental public health officers or inspectors. And in that capacity, we inspect water systems, restaurants, sewage disposal systems, pools and spas, and we even do tobacco control, making sure stores do not sell tobacco to minors.
I chose to come to BCIT because it is one of the few schools across Canada that offers the environmental health program. The instructors are all previous environmental health officers, and that's great because they can give us a lot of their knowledge and their experience in the field, and they make everything that we learn, they make it really applicable to the job.
Here at BCIT, we work you hard. 2 years worth of very intensive instructions, and we offer a 3-month practicum to all of our students, and so they get their training necessary to become a certified public health inspector after they're done with us.
So in the end of the day, it's about healthy communities. It makes me feel good that I've done my part. I'm a member of that community, and we get to do it together, and that makes me proud to do my job to be a public health inspector.
And we're going to turn it over to Dale.
Great. Thank you very much, Erin. And I see there's a couple of questions in the chat already. We'll get to them at the end of the presentation. And I think the presentation itself will probably answer some of these questions also. So, what is environmental public health? In case maybe the sharp eye among you noticed that in the video is a couple of years old now, and it did not have the word public in the name. So we recently added that word to our program name because the program itself is really about public health. And there's really two big sides of public health. There is the public health side where it's human to human transmission of disease, and it's usually the nurses that handle all of that. So public health nurses, they're giving immunizations to babies, talking about sexually transmitted infections, etc. Environmental public health is everything else. So it's the food that you eat, the water that you drink, the air that you breathe, the environment that you live in. All of those things are covered under the broad umbrella of environmental public health. And the program itself, we're really the only program where geared specifically towards public health. Most other paths within the public health realm involve going through nursing school or becoming a physician, and you are generalists before you specialize into public health, whereas we're a direct path into the public health field, which is really quite unique. So what we are is a 2-year full-time Bachelor of Environmental Public Health program. So when you graduate, you get a full bachelor's degree. And we have small class sizes. Currently, our class size is capped at 26. And the program is a combination of lectures, field trips, and research study. So we are delivering a solid theory-based knowledge as well as on hands-on knowledge as well. One of the questions was, is there a practicum arranged? And yes, that is unique to our program in that we do arrange that work experience for you with one of the regional health authorities in BC. So we cannot guarantee exactly where that will be, but it will be in BC somewhere with one of the regional health authorities. So it could be in Vancouver, Coastal Health, Fraser Health, Island Health, Interior Health, or Northern Health. It's 12 weeks to be exact. And that practicum is required as part of the certification process to become an environmental health officer. We're the only program in BC that is on the path towards certification, and the certificate enables you to work as a environmental health inspector or a public health officer or a public health inspector anywhere in Canada. In addition, graduation from the program is also a requirement of certification as well. So preferred qualities, as you can imagine, doing this job, going out and about, meeting new people all the time, being somebody who is mature, practical, assertive, is with strong communication skills is very important and a great advantage. Not necessarily to say you need to be the complete package coming in, because nobody is. I certainly wasn't when I first started the program, and I would say most people are not. But if you are able to develop those skills, or if you're able to come in with a good basis to develop those skills, I think those are great advantages. As you can imagine, this is a very public facing, people oriented job and profession. And therefore, having those skills and abilities are very helpful. So you do need to be able to work very independently. Sometimes you're completely on your own, but as well as in teams, because you do need to work with others, not just within the public health field itself, but when you're in the field, you'll be interacting with local governments, you'll be interacting with different provincial ministries, different federal ministries, nonprofit groups, all sorts of groups of people, members of the public, of course. So you do need to be able to work in a variety of environments. And as I touched on, good interpersonal skills, communication skills are also very important. And the last, but certainly not the least, is good problem solving and decision making skills. So, the word that people like to use is common sense, and I can definitely say sense is, it's never common. And people do interpret things a little bit differently, and sometimes you need to adapt your strategy and the way you approach things differently as well, depending on the situation. And being able to make those decisions, gauge what the situation is like, uh, with given circumstances, goes a long way. I think one of the things that employers always fear is one of the inspectors going out and getting into the local news headlines for being overly harsh or overly lax or something like that. And so being able to make those right decisions are very important, and being able to be confident in those decisions. So the benefits of an environmental health officer career. So Zach in that video touched on it. Um, and you know, the video itself featured some of those scenes, but it's a very diverse job. Um, you know, not to put down any other program at BCIT, but most of the health oriented programs are obviously you're going to be in a lab, or you're going to be in a clinic, or you're going to be at the hospital. We are very much not that. Environmental health officers are on the road, in the field, most of the times, almost every day, usually. You'll be going to different facilities every day, going to different locations every day, meeting different people every day. You're working with the public every day. So it's very much a on the road, on your feet type position. You're not stuck behind a desk all day. You might have to do some paperwork, absolutely, but you're definitely not stuck behind a desk all day. It's of great benefit to the community. You are working for public safety and public health, right? You're definitely not earning some billionaire some extra dollars at the end of their day, right? You're out there serving the public good, which is nothing to sneeze at for sure. It's very much a applied science background. So the knowledge that you may have gained in previous education, that knowledge that you'll gain here at BCIT, you will apply that in the field. You'll be able to say, the principles I've learned here applies to this situation, and therefore this is the right course of action that you need to take. And you'll be able to give that knowledge, educate others, and tell them how to do the right thing. Because that's 90% of the job, honestly. Being able to work with people and educating them on how to do the right thing to protect themselves and their families and their businesses. So I already said work outside the office, and then responsibility. So I touched on it. Sometimes you're on your own. Depending on where you are, you might be the only public health officer for the entire community, or for many communities if you're working quite rurally. And so you are entrusted with a great deal of power, really, and trust from the community to do the right thing. And that's a very big responsibility sometimes, in order to make sure that you are doing those, crossing all those I's and dotting all those T's in your day-to-day life. So I personally, when I was in the field, I viewed that as an absolute benefit, because I'm taking that on, that responsibility to for the betterment of the community, right? You're not. I view that as something very valuable in my career. Absolutely. So employment, and somebody quickly asked a question about that. So the vast majority of our graduates do end up working for regional health authorities here in BC and elsewhere in Canada. So Zach in that video, he's actually no longer there, because we do keep in touch with him, but he's working for the city of Burnaby now. But while he was there, he was with Fraser Health, which is the regional health authority here in Burnaby, Vancouver Coastal Health, etc. I sort of touched on all five of them here in BC and other provinces as well. Federally, there are also environmental health officer positions. They are often dealing with things like boats and ships and cruise ships and airliners and that kind of thing, anything under federal jurisdiction. First Nations often hires their own environmental health officers. In BC, we have the First Nations Health Authority, which specifically deals with on reserve public health matters. And then Health Canada employs quite a number of health inspectors as well. And then getting into a little bit more specialized, you've got things like drinking water officers, communicable disease specialists, healthy building environment specialists, cannabis inspectors. They all fall under the broad inspector type, public health type positions that you would all be qualified to take on. Some of them maybe with a little bit more experience under the belt, but eventually those are all career paths that you could take on. And then more adjacent type positions is CFIA, which stands for the Canadian Food Inspection Agency. They've been hiring lots of our grads. They value the skills that the graduates bring as well. They don't require certification, but certainly the skills that you learn here qualify you very much for the types of inspections that they do as well. When we're talking about private industry, there are opportunities as well, such as quality control and improvement for food processors and big grocery chains, and or big grocery chains sometimes hire their own internal inspectors or auditors to inspect their own restaurants to ensure, all their franchisees are meeting minimum requirements or something like that. There's quite a few of those types of agencies as well. Just today, very coincidentally, while I was secretly eating fast food for lunch, I met one of our past graduates, and he was working for a local environmental services company servicing all the restaurants in the Lower Mainland. I had no idea he was the only one. Basically, his company is servicing 900 food facilities in the Lower Mainland, and I'm like, "You're the only one," and he's like, "I'm the only one doing all of it." So I was like, "Wow, that's a lot of facilities." So yeah, lots of different types of opportunities as well. And then once you're in the public health realm, there are certain other types of positions that you could take on, such as food promotion, health promotion, health education type positions for health agencies or private consulting firms, etc. Teaching food safe on the side, lots of inspectors do that, etc. So lots of different types of employment opportunities there. So this is still brand new. I don't know how long this will last. Is that the BC government recognizes that this career is in demand. And so we're one of the programs being supported directly by the province, where they are giving $2,000 per year per student. So again, don't know how long that will last, but last year was this current year, I should say, is the first year they gave that money. So I think that's very helpful for any prospective students, because that's effectively around almost a quarter of the tuition, I think, for the entire program. Yeah, so which is great. And then for Indigenous students, Health Canada has many additional bursaries and supports as well, which would essentially cover your entire tuition as well as some part of living expenses. The details are not clear on that yet, but if you are someone with an Indigenous background, that would be available to you as well. So this is just a testimonial from Ian. I just saw him on Tuesday. He just convocated, so with the square hat and robe and everything today. So he just recently graduated. And he is now working as an environmental health officer on Vancouver Island. So he got a full-time position, permanent position there, and he's moving over there, and very happy. And uh, he's just saying that the job offers lots of flexibility regarding how you plan your day, and it's a combination of office and field work, and because you can easily transition to other roles within the public health field, and so he feels that it allows for individual professional development, which is sort of those things I touched on as well. So he certainly seemed happy. His family he had a big family group with him on Tuesday, so I was very glad to see him there. So admissions information, just next slide, please. So the program, we are still currently accepting applicants for fall 2024. So that's this coming September. The applying window is still open. Excuse me. But typically our application window opens October 1st. So for fall 2025, it will open October 1st of 2024. So basically it stays open until the program is filled and or a short waiting list is developed. So right now we still have seats for fall 2024. So if you're thinking about it, that is still available to you. But that's when the application period starts. And like I said, it stays open until the program fills up, which changes year to year. So it's not there's no strict end date, unfortunately. Application steps, there are a number of steps that you have to take. First, of course, is to review the entrance requirements on our webpage. Oh, I'm sorry, my window suddenly shrank. I'm trying to make it bigger again. There we go. You first to review the entrance requirements on our webpage, and now I'm going to talk about the entrance requirements shortly coming up as well as the application dates. You do need to ensure that all your documents are properly formatted and converted to PDF files, and then you can upload all your documents at bcit.ca/apply. There is an application fee involved. I don't remember exactly what the fee was off the top of my head, but but there is a small application fee, and then once you are accepted, you have a certain amount of time to pay your commitment fee, which I believe is $500, which secures your seat in the program. Mhm. If you don't pay your commitment fee, you will be deregistered, unfortunately. Yes. Next slide, please. So academic entrance requirements. So I sort of, alluded to this, but we are a 2-year bachelor's program. So you might wonder, how come a bachelor's program is only 2 years? It should be 4. And that's because we require post-secondary credits coming in. We're basically serving as the 3rd and 4th year of a 4-year degree is how you should look at it. So we are looking for 60 post-secondary credits coming in. 3 of those credits needs to be from an English course. 18 of those credits needs to be in at the second level, as at the second year undergraduate level, so second year level courses. We do need a biology course, we need a chemistry course, and then a minimum of 6 other additional science courses. So, not 6 additional courses, I mean 6 credits of additional science courses. Those courses could be physics, math, etc. Anything science related is fine. Those are our academic entrance requirements. So we do have a few non-academic entrance requirements as well. So there is a self-assessment form that you need to fill out. Part of that self-assessment form is filling in your various academic entrance requirements, but also to go and talk to an environmental health officer. So to call up your local environmental health office, talk to one of the health inspectors there, ask them about the job, about the career, get that information from them, and then to tell in your own words what you've learned about the career and why you think it's suitable for you. You might wonder, why do we ask people to do this? The reason we ask people to do this is so you know exactly what you're getting yourself into. We have very low rates of people dropping the program. So what I mean is we have almost nobody who applies to the programs, gets accepted, starts the program, and then a month in says, this program isn't for me, I'm going to quit. That never happens. The only time that happens is somebody finds a full-time job at CFIA and they're like, well, I already have the career I want. Bye. That does happen, okay, very occasionally, but no one says this career is not for me. I'm gone, because we do this, because you know exactly what the career is like. The environmental health officers out there are all happy to chat with prospective students because all of them have done this, right? Most of the environmental health officers working in BC are graduates of the BCIT program, because we're the only program in BC. So almost all of them have done that as they're part of their own journey. So they're more than happy to chat with prospective students. We also ask for your CV or curriculum vitae. It's because I do take a look and to ensure that you have around maybe a year's worth of accumulated work experience. Again, that is just to demonstrate that you have had the experience of working with people, of either in a some sort of capacity where you interact with the public. So it could be, a server at a restaurant, customer service, call center operator, whatever the case may be, or in a professional environment, in an office type environment, just to show that, yes, you do have some of those soft skills coming in. In the past, before bringing these kinds of requirements in, they occasionally do have a person who's never held a job in their life. And that person will struggle a little bit when they go out on practicum. It's because it's quite a harsh transition of having never worked before and then stopping school and going directly into that type of environment. It can be a challenge. And then finally, you do need access to a vehicle as well as a Class 5 license. The reason for that is on practicum, you will have to drive yourself. And if you can't drive yourself, especially in more rural areas, it becomes a really big impediment. So most people do find a way of finding a vehicle. You don't necessarily need your Class 5 to start the program, but you should have your Class 5 by the end of the program before going on practicum. Having your Class 7 isn't, critical sometimes, but some health authorities have fleet vehicles. and you cannot drive the fleet vehicle if you're on a class 7. You can only drive a fleet vehicle on a class 5. So that's why. And then the admissions process itself. So what happens is once you submit your application, it doesn't come to me directly. It first goes to our admissions department. They do a first check of all your documents, make sure everything there. You're at least showing the minimum requirements. And then if you're missing anything, they usually let you know, and then you have time to complete your application. Once the applications are complete, they've done that one over, it does come to me, and I look at every application and I kind of go, okay. And sometimes occasionally you might get a call from me or an email from me saying, are you sure? Are you about this? Or I might have questions about your qualifications or something like that. That doesn't happen all the time, so don't feel bad if I don't call you. It's probably a good thing. So, but once that happens, I then let admissions know to extend offers of acceptance, or there are sometimes maybe not, right? Saying, okay, this person does not actually meet our requirements. So that's how that process works. So unfortunately, it doesn't come to me directly. It does go to admissions first, and they do check everything to make sure that your applications are complete. So in terms of laddering opportunities, I would say if you don't wish to do any more education, you don't need to. Lots of field inspectors stay inspectors and or just at the field level for the most of their careers, or maybe go up to a specialist position, and that's fine. And I would say now there's some credential creep, as with all agencies, in that if you do wish to maybe one day take on more of a leadership role, management, that kind of thing, lots of people do masters now and things like that. So there are those pathways as well open to you as well through our program here at BCIT. I do get regular requests from past graduates to serve as references for master's applications and things like that. So those are options open to you, but it's certainly not necessary to at the very least get started in your career.
And I think I was going to talk to this one, Dale.
Yes, please.
So,
Thank you.
Dale, thank you for all that information. That was a lot for everyone to take in. So I hope you absorbed all that, but if you didn't, just a reminder that you will get a copy of the slide deck and a copy of the recording, and you're free to send us questions after the fact as well. But we've talked a lot about how to apply. Now I want to talk about what happens once you're a student at BCIT. And BCIT really wants to support your success as a student here. So going from left to right, we'll talk about some of the different supports that are available here. Firstly, if you are of an Indigenous background, BCIT Indigenous Initiatives is here for you to ensure a smooth transition into your first year study at BCIT. They offer peer-to-peer mentorship, a welcoming gathering place, and they provide clarifications on Indigenous funding options. The BCIT Student Financial Aid and Awards Department, they have information on awards, scholarship, bursaries, and of course, financial aid options. They can help you figure out how to apply and what to apply for. I will mention one award. That's the BCIT President's Entrance Award. And that selection is based on academic achievement, but also volunteer and community service. So if you're applying upcoming, I would definitely recommend you check that out. Accessibility services is for students who have a short-term or long-term disability that requires some sort of accommodation while they're in class and while they're in program at BCIT. So you can reach out to them as soon as you're accepted into a program. Think about students who might have had an IEP in high school. Those are the kinds of students that accessibility services often sees, but other students as well. Student Health Services is a great resource. We have a full service medical clinic here on the Burnaby campus, doctors and nurses on staff. So if you are unable to get into your GP in a timely manner, or if you don't have a GP currently, Student Health Services is a great resource for all of our students. In that same building, we also have counseling and student development, and counseling is available to talk to you about issues that you might be having, both related to school and things about just relationships or stress or anxiety. So they deal with a whole host of issues, and that is a confidential service, of course. And then we have recreation services. And this is a great one. A lot of our staff enjoy this as well. We have a full service gym, weight room, cardio machines. We have intramurals. We have fitness classes in the morning, after school, and at lunchtime. You can rent out equipment. So it's a great way to kind of think about your physical health as well while you're in school. And moving forward, so now that you've heard a lot about us, we would love it if you would connect with us on social media. BCIT Health Sciences encompasses more than 30 programs, environmental public health being one of them. And our health sciences group is on Facebook, Twitter, X, Instagram, YouTube, TikTok, and LinkedIn. And following one or many of our accounts is a great way to kind of see about student life at BCIT, see what our students are up to, what they're learning in classroom, what our faculty and staff are doing, events coming up, things that we're doing on campus. It's just a great way to see kind of what it's like to study at BCIT. And more specifically, environmental public health is now on Instagram as a program. So I believe their account is fairly new, but they've all got lots of posts up. There's a QR code right on your screen there if you want to take that, or just follow them at BCIT Environmental Public Health on Instagram. Again, great way to see what their students are up to. And I think that's one of the best ways when you're trying to make a decision about a program is to kind of see what the current students are doing, what they're saying, and how they feel about the programs. And if you're interested in learning more after this, we do have campus tours, we have spend a day programs, other info sessions like this, and we have our program advising department. One person I noticed in the chat was asking about that, if we had academic advising, or so we have what we call program advising at BCIT, and you can definitely reach out to them. Bavina from program advising is on the call today, and she's answering some of the questions in the chat. And so program advising can answer all your questions about how to apply, admissions details. Oh, here's their slide. And they have services available, Zoom, email, and other things. And you can check out their current hours and their current contact methods at bcit.ca/advising. And now we'll go to some questions and answers.
I'm happy just to go at the top from the top and go one by
Okay.
one, unless
Like
somebody
starting
has.
with, do you want to start with Shelley's questions then?
Yes, sure. So Shelley's first question regarding co-op, I did answer that. And so yes, it is guaranteed for all students. Is it paid or unpaid? There is a honorarium or a stipend given. The amount currently varies a little between health authorities, but it's not a formally paid practicum. It's more as an financial aid to help you in living costs while you're doing it, sort of thing. I would say that the expectation is that you're there to learn more than anything else. So that's sort of the attitude you need to go in with for that. It's seems that during the summer holiday there isn't anything. So the holiday during the first year, there is nothing formally scheduled. So that's June, July, and August between the first and second year. The program actually goes until the end of May. But by the summer of the second year, you are either starting on your practicum or finishing up your practicum by then. So all practicums should be concluded by the end of August of the second year. Yes, graduating from the. Oh, go ahead.
Okay. Oh, did you want to ask a question about working like Zach?
Yes, so Zach in that video was an environmental health officer, and I did touch on that in that most of our graduates do go on to that career path, but that's not the only career path that's available to you.
Great. Do EPH inspectors need to do labs with the samples, or do they only take the samples and communicate the results to business owners? That's a question.
That's a great question. No, you don't do the lab samples themselves. I shouldn't say never, because if you are working in a small office rurally, you might have like some basic lab equipment that you might try to run that's available to you. But the vast majority of time, you are taking samples, and then the samples are shipped off to a formal lab somewhere, and then you're interpreting the results for the person or the business. If you're working rurally, a very common request is just homeowners coming to you with water sample results from their well or something like that, and asking, can you please help me interpret what these results mean for me, etc.
Oh, interesting. Is there a limit
So
on how, yeah, that's really interesting. Is there a limit on how many bursaries get awarded per year?
maybe Pavina is a better person to ask. I'm not sure about that one.
Okay. Is the program, no, we've already
Can I
answered.
answer it? Can I answer that one?
Mhm.
The bursary one. So that's a question for financial aid and awards. So I'd recommend, I can put a link to the financial aid website. Maybe they can get in touch with the financial aid department.
What are the differences on duties between rural EHOs and city EHOs? We kind of touched on that a bit.
So yes, absolutely. And there is a difference. So when you're working in the city, EHOs tend to become a little bit more specialized. So what I mean by that is you will, especially in the very beginning of your career, you'll probably primarily be working with restaurants, personal services. So personal services range anything from, hair salons to tattoo parlors. So anything giving a service to a person and touching their body, but not regulated by a professional college. So doctors, dentists, professional massage therapists, they all are independently regulated. So then environmental health officers don't touch on those. But like tattoo parlors, nail salons, foot places, spas, that kind of thing. Those are all regulated by environmental health officers. And then pools is another big one in urban areas. In the rural areas, you cover a much broader range. And so you're doing anything from drinking water to sewage to land use to communicable diseases to the food, to the water, to everything. So your coverage is much more broad. In the city, they might have specific specialists for each one of those program areas, just because there's a lot more people, and so they're able to specialize, right? So that's probably the main difference between rural and urban EHOs. As a career example for myself, when I was in the field, I was in Northern Health, so I had a mix of urban and rural in my own personal area. So some days I'm doing what everybody does here in the city. I'm at the local mall checking out the food court, sort of thing. And then another day I was driving hours out into the bush and I was going and visiting a tree planting camp and ensuring that the local tree planters had proper water and kitchen facilities because, that's part of the job, right? So it just depends on the day when you're in a rural environment. Mm-hmm.
Are EHOs legislated?
So the credential is required all throughout the country. Because it's provincially regulated, it differs a little bit province to province, but every province basically requires it. In BC, I think it's under a ministerial order that environmental health officers need to be certified, and I don't think there are any environmental health officers in BC that are not certified, and it's generally considered a requirement. I think again it differs a little bit from province to province, but yes, again it is regulated. Environmental health officers coincidentally are the only named public health officer in the Public Health Act in BC, other than medical health officers. So medical health officers is a specialty as a physician. So when you're a doctor, you after your residency, you can become, I believe they're called community health specialists, and then you become a public health physician. So there aren't that many of them. There's only a few in the region. The vast majority of health officers are environmental health officers. So if you recall back to the height of the pandemic, Dr. Bonnie Henry was on the news every day talking about health officials are out there doing this and that. The vast majority of those health officials were environmental health officers. They're the only public health officers out there doing the field work. Yeah. Mm-hmm.
I'm just burning through questions here. There's so many. For the 18 second year credits, can
Mm-hmm.
those be in any discipline? Are they general elective courses?
Yes, any discipline, as long as it's two or more disciplines. It can't be all in one discipline.
Fair enough.
And I think you need to have a C plus on them. Mm-hmm.
Yeah. During the program, how do students feel? Is the course load easily manageable, or are students overwhelmed and stressed out? Or do they
So
enjoy this learning process? That's a great question, Harshal.
That's a great question, and I think this is common to all BCIT, almost all BCIT programs. We do load you up with work. I won't hide that. It's we do have a fairly heavy course load in material. I would not say the material is hard in that, oh, it's like a physics class at university, and sometimes you just don't know what's going on. The professor's talking, and you're like, this is mumbo jumbo. I don't understand what's going on. I would say rarely that's the case. This is going to be the material straightforward. There's just a lot of it, and we do have you do a lot of group work and projects and things like that. So it's definitely a full-time commitment. You're here, you will have classes every day. So yeah, no, it is a fairly full course load for sure. And I think that's common for all BCIT programs, where most programs are fairly all fairly heavy course loads here. Yeah.
But that being said, when I see environmental public health students around campus, they do seem to be enjoying themselves. They seem happy.
That's
They're
good.
not crying in the hallways or anything like that. They seem like happy people. They seem to be happy to be here.
And you know what? I would say that, and this is just anecdotally, I've heard from people who say, because we know, like employers, and who say we know BCIT and all the programs are heavy, like are workload heavy. So we're confident that a student who's graduated from any program at BCIT is able to handle a heavy course load, right? And not somebody who was able to sort of, sit back and skate through the
Yeah.
programs, because all the programs are fair. You have to do your work in order to pass.
Okay, next question. Shelley is asking about the CIPH exam.
Mhm.
Are there ever cases where students cannot pass the first time around the exam? What's the likelihood of
Yes.
passing?
So, first pass is fail on the first pass is actually not unusual. I would say our pass rate for the first attempt is around 60 to 70% most years. Um, there is both a written component of that certification as well as an oral component, sort of, which is really quite unique for the profession. I think we're one of the few that still has an oral exam. So, where you are sitting in front of a panel of examiners and they ask you, give you scenarios, and they ask you, what do you do? And you have to verbally respond to and give them the correct answer. So I would say, yeah, overall first attempt pass is anywhere, sometimes the high year might be 80, but usually around, 70%, I would say, is a typical. And then most of those people do pass on their second attempt. Um, Vanessa's still here. I think they may have recently modified it so that you could take it again. If you fail again, they might give you a third attempt, but I need to double check on that. I'm not sure, but you do get a few attempts.
Yeah, I believe there's a third attempt as well.
Third attempt as well. So basically after your third attempt, what they say is you need to redo your practicum. If you want to take the exam again, you need to redo your practicum. Is what they say after three attempts.
Okay, I have Dharma asking, they're currently working on their bachelor's degree and they're wondering if it's any benefit to finishing their bachelor's degree career-wise and then going into environmental health, or if they should just do the 2 years of their bachelor's and go into environmental. That might be a very personal question,
Yes.
depending on what
Yes.
your degree is and what your career aspirations are. So if you want to discuss that further, I suggest that you take a look at the email addresses on the screen. And that might be
Yes.
something you want to discuss with Dale or with program advising, probably with Dale, after the fact. Because yeah, some of those questions are harder for us to answer on the spot.
No, absolutely. I agree. That's a very personal question. So it depends on what you're doing now, what your plans are for the future, and then your personal situation, which is different for everybody.
Of course, yes.
Yeah, I get that question often, and I usually answer, if I knew now what I knew then, I would have jumped into the program ahead of time. So most of us, but that's again a personal decision. I graduated with a Bachelor of Science and degree in biology. And again, it would depend on financial situation as well. I think that would have geared me towards just jumping ship and heading right to BCIT. Again, personal answer.
And I was also a UBC grad before going through the program here at BCIT as well. Yes.
Okay, I'll let that last question
Mhm.
be for Bhavina, because I think that's a program advising question there. We are kind of we're pretty much out of time here for tonight. So I just wanted to finish off by saying that I really do, again, appreciate all of you taking time out of your evening to come and listen to us and learn about environmental health and share with us your questions. It's just great seeing enthusiasm for a new generation of environmental public health officers coming through. And I know this is one of those many programs that I think if I had known this existed when I was younger, I would have seriously considered it. But that's part of the battle, isn't it? Knowing what's out there. So thank you, Dale, so much for your time, and thank you for everybody that's been answering questions in the chat. And I hope you have a good evening. Please do keep in touch.
There was one question I see at the very end that we didn't touch on. It was from Jaskirat regarding ICES reports. So I do see ICES reports from people who are internationally educated, and it just depends on where your international credentials from and what the report actually says. So unfortunately, I can't predict for you, what your report will say, because that's such a
and once you have the report, program advising can actually go through that with you and help you see what matches up. They'll be able to help you with that.
And then Shelley says, when can people take a second attempt? Exams are October and April every year, and they're independently organized by the Canadian Institute of Public Health Inspectors, which is the professional organization. So our school doesn't have oversight over that. What we are accredited by them so that our graduates can take the exam, because otherwise graduates from other programs cannot take the exam.
Okay. Thank you very much, everyone.